Question 1. What is the primary purpose of positive air pressure in a sterile storage area? A. To prevent dust from settling on sterile items. B. To ensure comfortable working conditions for staff. C. To minimize the risk of airborne contaminants entering the area. D. To dry sterile packages more quickly. Answer: C. To minimize the risk of airborne contaminants entering the area. This question tests the understanding of airflow control in critical areas. The keyword positive air pressure is the main clue, indicating that air is pushed out of the room. This positive pressure helps prevent less clean air and potential airborne contaminants from flowing into the sterile storage area when doors are opened, thus protecting sterile supplies. For example, if you open the door to a sterile storage room, air flows from inside the room to the outside corridor, keeping contaminants out. Always remember that positive pressure helps maintain the cleanliness of sterile environments. Question 2. Before sterilization, instruments should be placed in an open position or disassembled if possible. What is the main reason for this? A. To allow for easier instrument counting. B. To prevent instruments from rusting. C. To ensure complete exposure of all surfaces to the sterilant. D. To reduce the overall weight of the sterilization load. Answer: C. To ensure complete exposure of all surfaces to the sterilant. This question focuses on proper instrument preparation for sterilization. The key phrase open position or disassembled highlights the goal of exposing every part of the instrument. If instruments are closed or assembled, the sterilant, like steam or gas, cannot reach all internal and mating surfaces, potentially leaving microbes untouched and compromising sterility. For example, scissors should be opened so steam can reach the pivot point. Proper instrument configuration is crucial for effective sterilization and patient safety. Question 3. What is the correct method for transporting soiled surgical instruments from the operating room to the decontamination area? A. Carried openly on a tray to air dry. B. Placed in a biohazard bag on a cart, covered. C. Hand carried in a clear plastic container. D. Transported immediately via pneumatic tube system. Answer: B. Placed in a biohazard bag on a cart, covered. This question assesses knowledge of safe transport of contaminated items. The keywords soiled surgical instruments and transporting emphasize the need for containment and safety. Soiled instruments are biohazardous and must be contained in a leak-proof, covered container labeled with a biohazard symbol during transport to prevent exposure to staff and the environment. For instance, a closed case cart or bin with a biohazard liner prevents spills and aerosolization. Always remember to contain biohazards to protect everyone. Question 4. What is the first step in the decontamination process for surgical instruments? A. Sterilization. B. Manual cleaning. C. Rinsing at the point of use. D. Disinfection. Answer: C. Rinsing at the point of use. This question tests the initial critical step in instrument reprocessing. The phrase first step in the decontamination process points to immediate action. Rinsing instruments at the point of use, e.g., in the operating room, with water or an enzymatic spray prevents blood and other organic material from drying onto the instrument surfaces, which makes subsequent cleaning much more difficult and less effective. Think of rinsing a dirty plate before putting it in the dishwasher. Timely rinsing significantly improves the efficacy of the entire cleaning process. Question 5. What organization sets standards for steam sterilization and sterile processing in healthcare facilities? A. Occupational Safety and Health Administration, OSHA. B. Food and Drug Administration, FDA. C. Association for the Advancement of Medical Instrumentation, AAMI. D. Centers for Disease Control and Prevention, CDC. Answer: C. Association for the Advancement of Medical Instrumentation, AAMI. This question tests knowledge of key regulatory and professional organizations. The phrase sets standards for steam sterilization and sterile processing specifically identifies the primary role of AAMI. While other organizations play roles in safety, OSHA, device approval, FDA, and infection control guidelines, CDC, AAMI develops comprehensive standards and recommended practices for medical device reprocessing that healthcare facilities typically follow. For example, AAMI ST79 is a widely referenced guideline for steam sterilization in healthcare facilities. Adhering to AAMI standards ensures best practices in sterile processing. Question 6. What type of water is generally recommended for the final rinse of surgical instruments in the decontamination area? A. Tap water. B. Softened water. C. Deionized or reverse osmosis, RO, water. D. Distilled water with added minerals. Answer: C. Deionized or reverse osmosis, RO, water. This question focuses on the quality of water used in reprocessing. The term final rinse is a critical clue, indicating the last step before drying and sterilization. Deionized, DI, or reverse osmosis, RO, water is preferred because it has fewer dissolved minerals and impurities, which prevents spotting, staining, and the formation of biofilms on instrument surfaces. Using regular tap water can leave mineral deposits that can interfere with sterilization and cause instrument damage. Think of how hard water leaves spots on dishes. DI/RO water prevents this on instruments. Question 7. Which of the following is an example of a chemical indicator used in sterilization? A. Bowie-Dick test. B. Biological indicator, BI. C. Integrator. D. Spore test. Answer: C. Integrator. This question asks about specific types of sterilization monitoring devices. The key phrase, chemical indicator, refers to devices that change color or form when exposed to specific sterilization conditions. An integrator is a chemical indicator designed to react to all critical parameters of a sterilization cycle, e.g., time, temperature, and steam presence, and provides a pass/fail result, unlike a Bowie-Dick which tests air removal, or biological indicators which test spore kill. Understanding the different types of indicators is crucial for verifying sterilization effectiveness. Question 8. What is the purpose of a biological indicator, BI? A. To confirm that instruments are physically present in the sterilizer. B. To test for air leaks in the sterilizer chamber. C. To verify the lethality of a sterilization process. D. To measure the temperature inside the sterilizer. Answer: C. To verify the lethality of a sterilization process. This question addresses the most crucial monitoring method for sterilization. A biological indicator, BI, is specifically designed to contain highly resistant bacterial spores, and its purpose is to directly challenge the sterilization process to ensure it can kill even the toughest microorganisms. If the BI shows no growth after incubation, it indicates the sterilization process was effective, lethal, in killing spores. Think of it as the ultimate proof that the sterilizer worked as intended. Question 9. Which of the following types of sterilization is most commonly used in healthcare facilities for heat and moisture-stable items? A. Ethylene oxide, ETO. B. Hydrogen peroxide gas plasma. C. Steam. D. Ozone. Answer: C. Steam. This question asks about the predominant sterilization method. The phrase, most commonly used for heat and moisture-stable items, is the key indicator for steam sterilization. Steam is efficient, relatively inexpensive, non-toxic, and penetrates fabrics and lumens well, making it the preferred method for items that can withstand high temperatures and moisture. Other methods like ETO, hydrogen peroxide, and ozone are typically used for heat or moisture-sensitive instruments. Most hospitals rely heavily on steam sterilizers for daily operations. Question 10. What personal protective equipment, PPE, should be worn when handling contaminated instruments in the decontamination area? A. Surgical mask and sterile gloves. B. Scrub suit and shoe covers. C. Impermeable gown, gloves, face shield, and fluid-resistant mask. D. Cloth gown and regular examination gloves. Answer: C. Impermeable gown, gloves, face shield, and fluid-resistant mask. This question assesses knowledge of safety in the decontamination area. The phrase handling contaminated instruments implies a high risk of exposure to blood, body fluids, and sharps. Therefore, comprehensive PPE, including an impermeable gown to protect clothing, gloves for hand protection, a face shield for eye/face splash protection, and a fluid-resistant mask for respiratory protection, is essential to prevent occupational exposure. It's like putting on rain gear before a storm. You need to protect your entire body from splashes and aerosols. Question 11. How should instruments with lumens, e.g., suction tips, endoscopes, be cleaned? A. Soaked in disinfectant only. B. Rinsed under tap water and air-dried. C. Brushed, flushed, and thoroughly cleaned according to manufacturer's instructions. D. Placed directly into an ultrasonic cleaner without prior brushing. Answer: C. Brushed, flushed, and thoroughly cleaned according to manufacturer's instructions. This question focuses on the specific challenge of cleaning instruments with lumens. The word lumens indicates hollow channels that are difficult to clean. Simply soaking or rinsing is insufficient. These channels must be physically brushed and flushed with cleaning solution to remove all organic material and debris from their inner surfaces, following the device manufacturer's validated instructions for use, IFU. Imagine trying to clean the inside of a drinking straw without a brush. Thorough mechanical cleaning is critical for patient safety. Question 12. Which of the following is a critical factor for effective steam sterilization? A. High humidity levels in the sterilizer. B. Presence of air in the sterilizer chamber. C. Proper temperature, pressure, and exposure time. D. Use of highly concentrated disinfectant solutions. Answer: C. Proper temperature, pressure, and exposure time. This question identifies the fundamental requirements for successful steam sterilization. The critical factors for steam sterilization are heat, temperature, pressure, to achieve and maintain temperature, and sufficient exposure time, which together ensure that all microorganisms are killed. The presence of air can create cool pockets, reducing effectiveness, and humidity isn't the primary factor for sterility. Think of cooking. If the temperature or time is off, the food might not be cooked through. All three parameters must be met for a successful steam sterilization cycle. Question 13. What is the purpose of the Bowie-Dick test? A. To test the effectiveness of a biological indicator. B. To verify the appropriate temperature in a steam sterilizer. C. To detect air leaks and evaluate air removal in a pre-vacuum steam sterilizer. D. To measure the concentration of sterilant gas in an ETO sterilizer. Answer: C. To detect air leaks and evaluate air removal in a pre-vacuum steam sterilizer. This question asks about a specific daily test in steam sterilization. The Bowie-Dick test is specifically designed to be performed daily in dynamic air removal, pre-vacuum, steam sterilizers. Its purpose is to check for adequate air removal and steam penetration by detecting any air pockets or leaks that could compromise sterility. It does not test biological indicators or measure temperature directly. Think of it as a daily checkup for the sterilizer's vacuum system, ensuring no air is trapped. Question 14. What term describes the process that renders a medical device safe for handling by reducing the number of microorganisms, but does not necessarily kill spores? A. Sterilization. B. Disinfection. C. Decontamination. D. Asepsis. Answer: B. Disinfection. This question defines a specific level of microbial reduction. The key phrases are reducing the number of microorganisms and does not necessarily kill spores. Disinfection is a process that kills many pathogenic microorganisms on inanimate objects, but it is not effective against all bacterial spores. Sterilization, in contrast, kills all microorganisms, including spores. For example, cleaning a counter with a disinfectant reduces germs, but it's not sterile. Question 15. What is the recommended cleaning agent for general environmental surfaces in the sterile processing department? A. High-level disinfectant. B. Sterilant. C. Detergent or general-purpose cleaner. D. Enzymatic cleaner. Answer: C. Detergent or general-purpose cleaner. This question asks about routine cleaning for surfaces, not instruments. The keywords general environmental surfaces imply areas that don't directly contact patients or sterile items. These surfaces, like countertops and floors, typically only require cleaning with a general-purpose detergent or cleaner to remove visible dirt and reduce microbial load, not a high-level disinfectant or sterilant. Think of cleaning your kitchen floor. You use soap and water, not a chemical sterilizer. Regular cleaning helps maintain overall departmental hygiene. Question 16. What is the purpose of an ultrasonic cleaner in the sterile processing department? A. To sterilize instruments using sound waves. B. To lubricate instruments before sterilization. C. To remove fine debris from instrument crevices through cavitation. D. To dry instruments quickly after washing. Answer: C. To remove fine debris from instrument crevices through cavitation. This question explains the function of a specific cleaning machine. An ultrasonic cleaner uses high-frequency sound waves to create microscopic bubbles that implode, cavitation, effectively dislodging and removing organic debris, blood, and tissue from hard-to-reach areas like hinges, lumens, and serrations. It's a cleaning tool, not a sterilizer or dryer. Imagine tiny scrub brushes reaching every nook and cranny on an instrument. Question 17. How frequently should biological indicators, BICE, be performed for steam sterilizers? A. Once a month. B. Once a week. C. At least daily, and with every implant load. D. Only when a sterilizer malfunctions. Answer: C. At least daily, and with every implant load. This question addresses the required frequency of biological indicator testing. Biological indicators are the most critical monitor of sterilization efficacy. AAMI standards recommend that BICE be run at least daily for each type of sterilizer used, and specifically for every load containing implantable devices, to ensure patient safety. This regular testing provides a consistent assurance that the sterilization process is effectively killing spores. It's like a daily quality check to confirm the sterilizer is consistently performing its job correctly. Question 18. What is the maximum temperature for the decontamination area? A. 60 degrees Fahrenheit 15.5 degrees Celsius. B. 75 degrees Fahrenheit 24 degrees Celsius. C. 80 degrees Fahrenheit 27 degrees Celsius. D. 90 degrees Fahrenheit 32 degrees Celsius. Answer: B. 75 degrees Fahrenheit 24 degrees Celsius. This question tests knowledge of environmental controls in sterile processing. The maximum temperature for the decontamination area is regulated to ensure staff comfort and prevent rapid drying of organic material on instruments, which can make cleaning more difficult. While cooler temperatures are preferred for comfort, exceeding 75 degrees Fahrenheit 24 degrees Celsius can be problematic. Maintaining appropriate temperature and humidity levels helps optimize both human performance and reprocessing efficiency. Question 19. What is the primary reason for wrapping instruments in a specific manner before sterilization? A. To make packages easier to store. B. To allow for visual inspection of instruments. C. To maintain sterility until point of use. D. To reduce the weight of the instrument sets. Answer: C. To maintain sterility until point of use. This question focuses on the purpose of sterile packaging. The phrase "primary reason for wrapping instruments" is the core concept. The sterile barrier system, packaging, is designed to create and maintain an aseptic environment around the instrument after sterilization, preventing recontamination from microorganisms until the package is opened for use in the sterile field. It's like a protective bubble that keeps the instrument sterile. Question 20. Which government agency regulates the manufacture and marketing of medical devices, including sterilizers and biological indicators? A. Occupational Safety and Health Administration, OSHA. B. Food and Drug Administration, FDA. C. Centers for Medicare and Medicaid Services, CMS. D. Environmental Protection Agency, EPA. Answer: B. Food and Drug Administration, FDA. This question asks about the role of a specific regulatory body. The FDA, Food and Drug Administration, is responsible for ensuring the safety and effectiveness of medical devices, including sterilizers, sterilants, and biological indicators, before they can be sold and used in healthcare. They approve these products for market, unlike OSHA, which focuses on worker safety, or EPA, which focuses on environmental protection. Think of the FDA as the gatekeeper for medical device safety and efficacy. Question 21. What is the purpose of cleaning instruments before disinfection or sterilization? A. To remove all living microorganisms. B. To enhance the aesthetic appearance of the instruments. C. To remove visible and invisible soil that can protect microorganisms from sterilants. D. To lubricate the instruments for easier assembly. Answer: C. To remove visible and invisible soil that can protect microorganisms from sterilants. This question highlights the foundational step of instrument reprocessing. The core concept is that cleaning, even if it doesn't kill all microbes, is critical because organic and inorganic soil, like blood, tissue, and bone, can act as a barrier, shielding microorganisms from the sterilizing agent. If instruments are not thoroughly clean, sterilization cannot be effective. Imagine trying to wash a dirty dish with a sticker on it. You need to remove the sticker first. Question 22. Which sterilization method is typically used for heat and moisture-sensitive items such as flexible endoscopes? A. Steam sterilization. B. Ethylene oxide, ETO. C. High-level disinfection, HLD. D. Dry heat sterilization. Answer: C. High-level disinfection, HLD. This question focuses on reprocessing delicate instruments. The phrase heat and moisture-sensitive items such as flexible endoscopes is a key indicator for methods that do not use high temperatures or steam. While ETO is a sterilization method for heat-sensitive items, flexible endoscopes are more commonly reprocessed using high-level disinfection, HLD, followed by sterile water rinse and drying, or sometimes liquid chemical sterilants, due to their intricate design and material compatibility. HLD kills most microorganisms but not necessarily all bacterial spores. Question 23. What should be done if a sterile package is found to be wet after sterilization? A. Dry it in a warm oven and re-sterilize. B. Assume it is contaminated and reprocess it. C. Place it in front of a fan to dry quickly. D. Use it immediately if it's for an urgent case. Answer: B. Assume it is contaminated and reprocess it. This question addresses the critical concept of maintaining sterility. The presence of moisture, wet after sterilization, compromises the integrity of the sterile barrier, potentially allowing microorganisms to wick through the packaging. Therefore, any wet package is considered contaminated, and its contents must be completely reprocessed, cleaned, packaged, and sterilized again, to ensure patient safety. Never assume a wet package is safe. When in doubt, reprocess. Question 24. What is the minimum recommended relative humidity in the sterile storage area? A. 20%. B. 30%. C. 40%. D. 50%. Answer: B. 30%. This question tests knowledge of environmental controls for sterile storage. The minimum recommended relative humidity in a sterile storage area is 30% to prevent the packaging materials from becoming too dry and brittle, which could lead to tears and compromise sterility. Extremely low humidity can also cause items to become susceptible to electrostatic charges, attracting dust. Maintaining appropriate humidity helps preserve the integrity of sterile packages. Question 25. What is the primary function of a mechanical washer disinfector? A. To sterilize instruments using high heat. B. To manually clean instruments prior to disinfection. C. To clean and high-level disinfect instruments automatically. D. To lubricate instruments before packaging. Answer: C. To clean and high-level disinfect instruments automatically. This question asks about the role of automated cleaning equipment. A mechanical washer disinfector automates the cleaning process and applies heat or chemical disinfection to significantly reduce microbial load, making instruments safe for handling and further processing. While some operate at temperatures that achieve pasteurization, they typically do not sterilize. Think of it as a powerful, specialized dishwasher that also disinfects. Question 26. Which class of fire extinguisher is used for electrical fires? A. Class A. B. Class B. C. Class C. D. Class D. Answer: C. Class C. This question tests basic safety knowledge regarding fire classifications. Class C fires involve energized electrical equipment, and a Class C extinguisher is specifically designed to be non-conductive, making it safe to use on such fires without risk of electrocution. Class A is for ordinary combustibles, Class B for flammable liquids/gases, and Class D for combustible metals. Knowing the correct extinguisher type is vital for fire safety in the workplace. Question 27. What is the purpose of tracing implantable medical devices? A. To track individual technician performance. B. To ensure proper billing procedures. C. To allow for recall if a problem is identified with the device or lot. D. To determine the cost-effectiveness of implant usage. Answer: C. To allow for recall if a problem is identified with the device or lot. This question focuses on the importance of tracking specific medical devices. The purpose of tracing implantable medical devices is crucial for patient safety. It ensures that if a manufacturer issues a recall or safety alert for a specific lot number, the hospital can quickly identify which patients received the affected device, allowing for immediate follow-up and intervention. This traceability is a critical component of post-market surveillance and quality control. Question 28. What type of packaging material is typically used for items that will be sterilized by low-temperature methods like hydrogen peroxide gas plasma? A. Woven textiles, reusable wraps. B. Muslin wraps. C. Spunbond polyolefin, e.g., Tyvek. D. Heavy-duty cardboard boxes. Answer: C. Spunbond polyolefin, e.g., Tyvek. This question addresses packaging materials compatible with specific sterilization methods. Low-temperature methods like hydrogen peroxide gas plasma are key, as these methods cannot penetrate traditional cellulose-based materials, like paper or muslin, due to their molecular structure. Spunbond polyolefin, like Tyvek, is a synthetic, non-cellulose material that allows the sterilant to penetrate while maintaining a microbial barrier. Always choose packaging that is compatible with the chosen sterilization method. Question 29. What does the term flash sterilization typically refer to? A. Sterilization of wrapped instruments in a standard cycle. B. Sterilization of unwrapped instruments for immediate use. C. Sterilization using a chemical bath with very short contact time. D. Sterilization using a specialized high-speed ETO process. Answer: B. Sterilization of unwrapped instruments for immediate use. This question defines a specific type of rapid sterilization. Flash sterilization, now more commonly referred to as immediate-use steam sterilization, IUSS, involves the rapid sterilization of unwrapped instruments for immediate use, often in an emergency. It should only be performed when there's insufficient time to process items by the preferred method and should be avoided for implants due to increased risk of contamination. IUSS is a contingency, not a routine practice. Question 30. Which area within the sterile processing department is responsible for receiving, cleaning, and decontaminating soiled instruments? A. Preparation and packaging area. B. Sterile storage area. C. Decontamination area. D. Sterilization area. Answer: C. Decontamination area. This question asks about the primary function of a specific SPD zone. The decontamination area is the designated space where soiled instruments are received, sorted, manually cleaned, and often processed through automated washers. It is designed with negative air pressure and appropriate PPE requirements to contain contaminants. Think of it as the dirty side of the department, where the cleaning process begins. Question 31. When assembling an instrument set for sterilization, what is the purpose of placing a towel on the bottom of the container? A. To absorb excess moisture from the instruments. B. To reduce noise during transportation. C. To prevent instruments from rattling and shifting. D. To protect instruments from damage and absorb condensation. Answer: D. To protect instruments from damage and absorb condensation. This question focuses on proper instrument set assembly. Placing a towel or mat at the bottom of an instrument container serves two main purposes. It prevents delicate instruments from being scratched or damaged by direct contact with the hard metal bottom, and it can absorb condensation during the steam sterilization cycle, helping to ensure the set dries properly and preventing wet packs. It's a simple step that protects both instruments and the sterile integrity of the package. Question 32. What is the recommended method for cooling sterilized items after removal from the sterilizer? A. Place them immediately into the sterile storage area. B. Place them on a cool metal cart in the decontamination area. C. Allow them to cool on a designated cooling rack or cart in a low-traffic area. D. Put them in a refrigerator to speed up the cooling process. Answer: C. Allow them to cool on a designated cooling rack or cart in a low-traffic area. This question addresses the post-sterilization cooling process. Sterilized items must be allowed to cool slowly and naturally on a cooling cart or rack in a clean, low traffic area. Rapid cooling or placing hot packs on cold surfaces can lead to condensation inside the package, compromising sterility, a phenomenon known as superheating followed by cold shock. Proper cooling is essential to maintain the integrity of the sterile barrier. Question 33. What is the most common cause of sterilization failures in healthcare facilities? A. Malfunctioning sterilizers. B. Incorrect sterilizer loading or improper cleaning. C. Using expired biological indicators. D. Power outages. Answer: B. Incorrect sterilizer loading or improper cleaning. This question identifies the leading operational challenge in sterilization. While equipment malfunctions or expired indicators can cause failures, the most frequent reason for sterilization failures is human error, specifically inadequate cleaning of instruments or improper loading of the sterilizer, which prevents the sterilant from contacting all surfaces. No sterilizer can reliably sterilize a dirty or improperly loaded instrument set. Always remember, if it's not clean, it can't be sterile. Question 34. What is the primary risk associated with using tap water for the final rinse of surgical instruments? A. It causes instruments to rust immediately. B. It can leave mineral deposits and microorganisms on the instruments. C. It will make instruments too slick to handle. D. It evaporates too slowly. Answer: B. It can leave mineral deposits and microorganisms on the instruments. This question focuses on the quality of water for rinsing. The primary risk of using tap water for the final rinse is that it often contains dissolved minerals, like calcium and magnesium, and potentially microorganisms, which can be deposited on the instrument surfaces as they dry, leading to spots, stains, and even a reintroduction of bioburden. These deposits can also interfere with subsequent sterilization. Always use purified water like DI or RO water for the final rinse to prevent these issues. Question 35. What is the purpose of a lumen in a surgical instrument? A. To hold a battery. B. To provide a channel for fluids or instruments to pass through. C. To make the instrument lighter. D. To increase the instrument's strength. Answer: B. To provide a channel for fluids or instruments to pass through. This question asks for the definition of a common instrument feature. A lumen refers to a hollow channel or passageway within an instrument, designed to allow the passage of fluids, like irrigation or suction, or other smaller instruments, like biopsy forceps or wires. Flexible endoscopes, cannulas, and suction tubes are common examples of instruments with lumens. Understanding lumens is critical for proper cleaning and reprocessing. Question 36. What is the recommended method for drying instruments after manual cleaning and rinsing? A. Air dry on a rack in the decontamination area. B. Use a clean, lint-free towel immediately. C. Place in a mechanical dryer or use a forced air drying gun. D. Let them soak in a drying solution. Answer: C. Place in a mechanical dryer or use a forced air drying gun. This question focuses on proper drying techniques. After manual cleaning and rinsing, instruments should be thoroughly dried, typically using a mechanical forced air dryer or a filtered compressed air gun. This prevents water spots, rust, and the growth of microorganisms, which require moisture to proliferate. Air drying alone is often insufficient and can lead to recontamination. Proper drying is crucial before inspection and packaging. Question 37. What is the first line of defense against biological hazards in the sterile processing department? A. Vaccination. B. Personal protective equipment, PPE. C. Handwashing. D. Engineering controls. Answer: D. Engineering controls. This question asks about the hierarchy of controls for safety. While PPE and hand washing are crucial, engineering controls are considered the first line of defense against hazards because they eliminate or reduce the hazard at the source, preventing exposure rather than just protecting the worker. Examples include negative air pressure and decontamination, sharps containers, and biological safety cabinets. These controls are built into the workplace designed to provide inherent protection. Question 38. How should heavy instrument sets be loaded into a steam sterilizer? A. On the top rack to ensure full steam penetration. B. On the bottom rack, standing upright. C. On the bottom shelf of the sterilizer cart. D. Mixed evenly throughout the load with light items. Answer: C. On the bottom shelf of the sterilizer cart. This question addresses proper loading techniques for steam sterilizers. Heavy instrument sets should always be placed on the bottom shelf of the sterilizer cart because steam enters the chamber from the top and exits from the bottom. Placing heavier, denser items lower allows air to be effectively displaced by the steam, preventing air pockets that could impede sterilization. It's about ensuring proper steam penetration and air removal. Question 39. What is the purpose of a count sheet in an instrument set? A. To track the number of times an instrument has been used. B. To list all items in the set and verify completeness. C. To document the cost of each instrument. D. To record the sterilizer cycle parameters. Answer: B. To list all items in the set and verify completeness. This question asks about a common tool in instrument preparation. A count sheet is a vital document included with each instrument set that provides a detailed list of every instrument and accessory expected to be in that set. Its purpose is to guide the assembly technician in ensuring all items are present and correctly organized, and for the surgical team to verify the completeness of the set before and after a procedure. It acts as a checklist for instrument accountability. Question 40. What is the most common method for sterilizing surgical scalpels and single-use disposable items? A. Steam. B. Ethylene oxide, ETO. C. Hydrogen peroxide gas plasma. D. Gamma irradiation. Answer: D. Gamma irradiation. This question asks about industrial sterilization methods for commercially produced items. While ETO and hydrogen peroxide are used in healthcare facilities for heat-sensitive items, gamma irradiation is the most common method used by manufacturers for sterilizing large quantities of prepackaged, single-use disposable medical devices, including scalpels, syringes, and gauze. This method uses ionizing radiation and is highly effective and efficient for bulk processing. Question 41. What is the primary reason for performing a leak test on flexible endoscopes? A. To verify the functionality of the light source. B. To detect damage to the external sheath and internal channels. C. To check the sharpness of the biopsy channel. D. To determine if the scope needs lubrication. Answer: B. To detect damage to the external sheath and internal channels. This question addresses a critical step in endoscope reprocessing. Performing a leak test on flexible endoscopes is paramount because it detects microscopic holes or damage in the scope's exterior and internal channels. Even tiny leaks can allow fluids to enter the scope, causing irreparable damage to internal electronics and optics, and creating areas where microorganisms can harbor, compromising disinfection. Finding and repairing leaks is essential to prevent damage and ensure effective reprocessing. Question 42. What is the importance of point-of-use cleaning for instruments? A. It eliminates the need for further cleaning in SPD. B. It sterilizes instruments before transport. C. It prevents blood and organic material from drying onto instruments, making cleaning easier. D. It provides initial lubrication for the instruments. Answer: C. It prevents blood and organic material from drying onto instruments, making cleaning easier. This question highlights a crucial initial step in instrument reprocessing. Point-of-use cleaning involves wiping instruments and keeping them moist immediately after use in the operating room. This critical first step prevents blood, tissue, and other organic matter from drying and hardening onto the instrument surfaces, which makes subsequent cleaning in the sterile processing department significantly more difficult and less effective. It is not a sterilization step, but rather a vital precursor to effective decontamination. Question 43. What is the acceptable temperature range for the sterile storage area? A. 50 degrees Fahrenheit to 60 degrees Fahrenheit, 10 degrees Celsius to 15.5 degrees Celsius. B. 60 degrees Fahrenheit to 75 degrees Fahrenheit, 15.5 degrees Celsius to 24 degrees Celsius. C. 70 degrees Fahrenheit to 80 degrees Fahrenheit, 21 degrees Celsius to 27 degrees Celsius. D. 75 degrees Fahrenheit to 90 degrees Fahrenheit, 24 degrees Celsius to 32 degrees Celsius. Answer: B. 60 degrees Fahrenheit to 75 degrees Fahrenheit, 15.5 degrees Celsius to 24 degrees Celsius. This question tests knowledge of environmental conditions for sterile storage. The acceptable temperature range for sterile storage is typically maintained between 60 degrees Fahrenheit 15.5 degrees Celsius and 75 degrees Fahrenheit 24 degrees Celsius. This range helps to preserve the integrity of packaging materials and prevents degradation of sterile supplies, contributing to a stable environment for maintaining sterility. Keeping the area within this range is essential for long-term sterility assurance. Question 44. How long should sterile instruments be quarantined if a biological indicator, BI, test fails? A. 24 hours. B. 48 hours. C. All items processed in that sterilizer since the last negative BI. D. Only the items from the load that failed the BI. Answer: C. All items processed in that sterilizer since the last negative BI. This question addresses the critical response to a sterilization failure. If a biological indicator, BI, test fails, it indicates that the sterilization process was ineffective. Therefore, all items processed in that specific sterilizer since the last documented negative, passing, BI result must be considered unsterile and quarantined for reprocessing. This ensures that no potentially unsterile items are used on patients, upholding patient safety. Question 45. What is the purpose of cleaning the outside of rigid sterilization containers before opening them in the sterile field? A. To remove any remaining sterilant residue. B. To prevent the introduction of microorganisms into the sterile field. C. To verify the integrity of the container's seals. D. To make the container easier to handle. Answer: B. To prevent the introduction of microorganisms into the sterile field. This question emphasizes aseptic technique. Even though the contents inside a rigid sterilization container are sterile, the outside surface can accumulate dust and microorganisms during storage and transport. Cleaning the outside before opening ensures that these external contaminants are not introduced into the sterile field when the container is opened, protecting the sterility of the instruments within. Think of wiping a can before opening it to pour a drink. Question 46. What does the term bioburden refer to in sterile processing? A. The weight of an instrument set. B. The type of packaging material used. C. The number of microorganisms on an object. D. The amount of chemical disinfectant used. Answer: C. The number of microorganisms on an object. This question defines a fundamental term in infection control. Bioburden refers to the actual number of viable microorganisms present on an object before sterilization or disinfection. A higher bioburden makes it more challenging for a sterilization or disinfection process to be effective, which is why thorough cleaning is so critical. Reducing bioburden through cleaning is the first essential step in ensuring a successful sterile outcome. Question 47. Which type of scope can be completely immersed in liquid for reprocessing? A. Flexible endoscope. B. Rigid endoscope. C. Video endoscope. D. Colonoscope. Answer: B. Rigid endoscope. This question differentiates types of endoscopes based on their reprocessing compatibility. Rigid endoscopes, like laparoscopes or arthroscopes, are generally constructed to be fully immersible in cleaning solutions and can withstand steam sterilization, unlike flexible endoscopes, which include video endoscopes and colonoscopes, that contain delicate electronics and fiber optics sensitive to heat and moisture. Always check manufacturer's instructions, but rigid scopes are typically designed for full immersion. Question 48. What is the proper orientation for paper plastic pouches in a sterilizer? A. Flat on the shelf, with paper side down. B. Stacked on top of each other. C. On edge, paper to plastic, or paper to paper. D. Flat on the shelf, with plastic side down. Answer: C. On edge, paper to plastic, or paper to paper. This question addresses correct loading for specific packaging. Paper plastic pouches should be loaded on edge, standing vertically, either paper to plastic side or paper to paper side. This orientation allows for proper air removal, steam penetration, and drying within the sterilizer chamber. Stacking them flat can trap air or condensation, leading to sterilization failure or wet packs. Proper loading ensures the sterilant reaches all surfaces. Question 49. What is the role of a quality assurance program in sterile processing? A. To identify individual staff errors for disciplinary action. B. To ensure compliance with regulations and standards, and monitor processes for consistent quality. C. To reduce the number of instruments used in surgery. D. To manage the department's budget. Answer: B. To ensure compliance with regulations and standards, and monitor processes for consistent quality. This question asks about the comprehensive purpose of quality assurance. A quality assurance program in sterile processing is designed to systematically monitor all steps of reprocessing, from decontamination to sterilization and storage, to ensure that the department consistently meets established standards, regulations, and manufacturer's instructions. Its goal is continuous improvement and patient safety, not just finding faults. It's about building a reliable system that consistently produces sterile items. Question 50. What is the minimum air exchanges per hour recommended for a decontamination area? A. 6 air exchanges per hour. B. 10 air exchanges per hour. C. 15 air exchanges per hour. D. 20 air exchanges per hour. Answer: B. 10 air exchanges per hour. This question tests knowledge of ventilation requirements. The minimum air exchanges per hour recommended for a decontamination area is 10. This ensures adequate air circulation and removal of airborne contaminants, reducing staff exposure to aerosols and odors generated during instrument cleaning. Proper ventilation is a key engineering control for maintaining a safe working environment and preventing the spread of airborne pathogens.